So really the idea was to transpose all what we have developed with dermatologists in our actual clinical research with standardized clinical scales, with pictures describing some facial signs, whatever ethnicities, whatever gender, and to be able to use them directly on a selfie images, that means self-taken image by the consumer or the volunteer with their own smartphone. To achieve this goal, we have leveraged a huge database in terms of pictures with standardized clinical pictures, but also pictures taken by smartphone with different lighting conditions, because it was very important for us to be able to take into account this variability. All these pictures were graded by experts and dermatologists, between 12 and 15 experts on each picture, regarding our standardized scales. So we have a huge data set, we have the picture, we have the evaluation by expert and dermatologist, and we use all the principles of artificial intelligence with the convolutional neural networks to be able to create an algorithm that have learned from expert and dermatologists to be able to grade the picture with the most accurate way. And generally in this kind of process, we keep 85–90% of the data set for the learning, and between 10 and 15% of the data set to apply and check the potentialities of the algorithm. We have for Caucasian women, for North Asian women, Indian women, African descent women. And each time when we have created these scales, we have worked with dermatologists of these countries we have evaluated. Based on that, after we have the tools, so we could train people to score, and it's not a question after of nationalities, of culture, because you have a scale to evaluate, so it's far more easy to standardize the evaluation. But at the beginning, the scale were created with experts and dermatologists of all the countries we go to analyze the skin picture that was previously graded. And after, so this algorithm that we have all validated with dermatologists. That means we go to see dermatologists directly in practice. We ask them to score in live their patient, to ask the patient to take a selfie, and we check that we have a good correlation, more than 90% for some facial signs, between the live scoring and also the automatic grading. So we have this validation. Based on that, we have integrated this algorithm into some experience, like Skin Consult AI today. And I think currently we have more than 500,000 diagnostics that have been done with this app. So really what we want to bring to our consumer, but to bring also to dermatologists and scientific community, it's a tool with a very high accuracy that they could use every day. They could be used for prescription, but also they could be used to follow their patient, to discuss potentially of the result of injection, I don't know. But it's really this kind of thing we want to bring to our consumer and scientific community. So for now, we are really working on facial signs that are not really linked to pathology. So it's really aesthetical impact with nasolabial fold, so it's wrinkles, it's sagging, it's pigmentation, redness, pores. Of course, we could see things and have a feedback to the consumer or the patient that are using this service to say you have to go to your dermatologist because here maybe we see something that is not coherent with your age, for example. If at one age you are completely different to the average of this age cluster, definitely it could be an alert, and we could say to them, go to your dermatologist. Or maybe we could imagine to have partnership with dermatologists to use this tool as an addition of other examination. I think regarding the accuracy of the system, what we could notice also is we have checked if it's impacted by expression of the faces, if it could be impacted by the position of the camera when you are taking the selfies. And definitely, yes, it has an impact, and I think it's good news for the algorithm, because if we don't see a difference, that means we are not at the accuracy we said. But also that this impact is low, around 10%. So regarding a diagnostic, it's really something acceptable to keep the accuracy. And the other, I think, big interest of this kind of system is when we compare the results of the selfies we have taken for the validation, and we compare to a group of 15 experts of dermatologists, we have a better accuracy. Because when you take 15 people, they could be very sensitive with their own perception, but you have a variability. So also in terms of epidemiological research or whatever, we bring also accuracy with this kind of app or services.